Students that are interested in becoming radiologic technologists often arrange to observe in the department. Let's listen in as a technologist explains to shadow students the process of producing a diagnostic X-ray image.
Okay, girls, this is a typical X-ray room. This is our X-ray tube. It has several controls on it. This button allows us to move the tube up and down. This one side to side. We can move it longitudinally with this button. And this one allows us to angle the tube either direction. So I'm going to let you go ahead and try moving it around a little bit so you get the feel. So next we have the Bucky trays, and those are the trays that hold the image receptors. The image receptor used to be called our film cassette, but we don't use film anymore. So this is what it looks like. It has a green stripe at the top, and the green stripe needs to go either to the patient's head or towards their right side. So if we're doing an abdomen x-ray on this patient, their head would be here. We're going to put the green stripe to the top. We slide it in. We push this to lock it. The image receptor is secure, and then we push the tray in like that. And this is our wall Bucky. We use it for exams that we need to do upright, such as chest x-rays. And the patient standing up, the green stripes go into their head. Goes in like that and locks. So I'm going to have you go ahead and try and put the image receptor into the Bucky tray. Okay, sometimes we have to be in the room with the patient when we're taking an x-ray. So we have aprons that we wear. We also have a lap shield to be able to shield patients themselves. This is an apron that we wear. Just slides on from the front. And then the straps cross and back and Velcro around to the front, okay? I'm gonna let you go ahead and try this on.
I've seen different ones. Are they all different? Some go all the way around the back and some are like two pieces, or?
That's right. They come in all kinds of styles and colors. Fits perfect, right?
Yes. Okay.
And then this is a thyroid shield. It goes around your neck to shield your thyroid. Great. So now I'm going to show you the control panel. Okay, when we take an x-ray, we need to decide what factors we're going to use. So we need to decide how strong of an x-ray we want and how many x-rays that we need to use. We determine that by the type of the body part and the size of the body part. So the KVP controls how strong the x-ray is, and the mass is what controls how many there are. So on this control panel, if we were going to take an x-ray of a foot, for example, we would pick extremity. If it was going to be a foot, we'll pick foot, and it gives us the factors of 60 for KVP and 2.6 for mass. And we can determine if that's correct by measuring the body part itself. If we need to adjust it, we just can go up or down wherever we need to be. So I'm going to have you go ahead, and we're going to pick extremity off the control panel, and then find foot on the menu. And then we have 60 kVp and 2.6 mass. So it's already preset, and after we measure our body part, then we can check the technique chart. So next we're going to try and take a x-ray of our phantom foot here. This is our image receptor. Again, the green stripe needs to go to the part of the body that's going to hang at the top. So we're putting it towards the toes. That's how the x-ray will hang. So we're going to need to move the tube up and down towards the foot. We have a measuring tape on here. So we're going to measure the distance from the tube to the image receptor. It needs to be 40 inches.
32.
So let's bring the tube up. And Corrine, maybe you can help measure.
Yeah, at about 38, 39, 40.
Perfect. So for a foot, we're going to need a tube angle. And so we're going to angle 5 to 7 degrees this direction. Let's put it at about 7 degrees towards me.
Very touchy.
Now we can adjust our x-ray field with these controls. It makes it bigger and smaller. And we want the light field to be just around the perimeter of the foot. We don't want it bigger than we need, because that's our x-ray field. And we need to measure the foot, and we'll have you go ahead and measure. We look at the bottom and how much do we have there?
5.
Okay. The last thing we need to do is put a marker on there. We're going to let anyone who looks at this x-ray know it was the right foot we x-rayed, so I put a right marker on there. So now that we've measured our foot to see how big it is, and what did it measure?
5 centimeters.
Okay, we're going to check our technique chart. And here's the foot on our technique chart. For a 5 to 7 centimeter foot, it wants us to use 60 kVp and 2.5 mass. So we compare that to our control panel of 2.6 and 60. So we're good to go. So we're ready to make our exposure. We first start the anode spinning with the rotor like that. When it turns green, we push the exposure button down until we hear the beep. Okay, so we'll let you go ahead and try it. And go ahead and make the exposure. Perfect. Okay. So to process our image, we come over to the QA station, and we're going to just put in a pretend patient here. We're ready to go. So we have a menu here that lets us pick again. It's a lower extremity, and we're going to find our foot on here and start our study. We're going to scan the barcode and put it in the processor. And so here is our image that we took. And some of the things you'll learn in lab will be the bones in the foot and how to determine whether that's an optimal image or not.
Once students are accepted into the radiology program, they practice procedures in a lab setting prior to doing them on patients. Let's observe a short practice segment.
Thanks for coming in to practice with me today, Corrine.
Sure.
I want to practice a chest x-ray. So I'm going to put this around your waist here. If you can grab that strap and bring it around for me there, please. Thank you. So we're going to start with your chest up against the board here, okay? If you can get up kind of close there. I'm going to feel on your shoulder bone here. And I'm going to feel for your spine. The board's going to move in front of you here, okay?
Okay.
All right. Now if you can wrap your arms around the board there for me. Okay, and kind of roll your shoulders forward a little bit. All right. Try to hold really still right there. Don't move, okay? Okay, Corrine, can you take in a breath? Blow it all the way out. Take in another deep breath and hold it in.
Adam, I'm going to have you try that one more time. I just need you to slow down and watch her as she breathes. Give her the instructions as she goes.
Okay. Corrine, can you take in a breath? Blow it all the way out. Take in another deep breath and hold it in. You can breathe.
Great, that was good.